You're watching an RH Reality Check production brought to you by rhrealitycheck.org.
On this episode of Reality Check, we'll address a topic on the minds of anyone who's had a copay. What should or shouldn't be covered by your healthcare plan? Or, to be more specific, should contraception be covered? And is it fair to cover erectile dysfunction drugs but not contraception?
Now wait just a minute. Like Bill O'Reilly said, it's fair to cover Viagra and not birth control. Erectile dysfunction is a medical condition that needs treatment. Birth control isn't.
I detect a double standard. Are you trying to say that it's medically necessary for men to have sex but not for women? How would that work exactly, at least for straight men? And who are they going to use that Viagra with if women have to opt out because their contraception isn't covered by their healthcare plans?
No, I think men and women are equal. I just mean that erectile dysfunction is a medical condition that Viagra treats. Birth control doesn't treat any disease, it's just so you can have sex without getting pregnant. I don't think that healthcare plans should have to cover you when you aren't even sick.
Birth control is prevention, though. It prevents pregnancy, as I'm sure you know. Prevention is a legitimate concern for healthcare plans. In fact, most insurance companies currently cover many preventive medications. Cholesterol medication and insulin are two examples.
You shouldn't equate pregnancy with a heart attack or an insulin attack. Pregnancy is not an illness. It's a wonderful thing to bring a life into this world. And isn't treating pregnancy like an illness insulting to women and babies and life itself?
Pregnancy is unique as a medical condition because sometimes it's a choice. And when it's a choice, it's a beautiful thing. But whether or not it's a choice, it's still a medical condition and it still requires medical care. And sometimes it's a very dangerous condition. That some women welcome pregnancy with open arms doesn't mean we should foist it on the unwilling. At the end of the day, it's foolish for both private and government-run healthcare plans to not cover contraception. The savings in childbirth-related medical costs alone justify the cost of it. More than that, health organizations from the American Medical Association to the Centers for Disease Control to the World Health Organization all agree that contraception and pregnancy spacing are a critical part of proper health care for women and the babies that they do have.